everyone, and thank you so much for joining today's NeedyMed special topic webinar, Becoming an Empowered Patient, presented by NeedyMed's partner, Mended Hearts. My name is Carla. I'm the Director of User Engagement at NeedyMeds, and before we get started, I'm going to offer a few tips so you can make the most out of the presentation. First of all, if you do have questions, you can feel free to ask them at any time by typing them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the chance to answer all the questions, to those of you who had questions we don't get the chance to get to, don't worry, we will follow up with you by email. And of course, we will also provide the contact information for both NeedyMeds and Mended Hearts at the end. Also, just to let you know, this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. And as you saw a couple of slides ago, we did upload our PowerPoint presentations and other handouts we thought you'd be interested in into that handout section of your GoToWebinar control panel. So check that out as well. So let's get started with what is NeedyMeds. For those of you not familiar with us, we are a national nonprofit co-founded more than 2 decades ago by a retired family physician, Dr. Rich Sagel, and his friend, Libby Overly, who was a medical social worker. What you're looking at is our mission statement, but simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. During these presentations, I always like to put up a screenshot of the homepage of needymeds.org because really our website is the face of our organization, but it also gives me an opportunity to point out just a few things. For example, if you're looking for healthcare savings options, go ahead and check out that healthcare savings tab. Right next to that, you'll find our education tab. That's where you can check out upcoming webinars, sign up for our newsletters, or order drug discount cards and our brochures, for example. So I mentioned that today's webinar is being recorded and will be uploaded onto our YouTube channel, and you can find a link to that on the top right of our website with the rest of the social media icons. It's the third one from the left. I also will point out the calendar of events on the bottom right hand of our home screen. In addition to finding webinars under that education tab, you can also find them on the calendar of events. So please check that out. So now, as you saw a couple of slides ago, a big part of our mission is education. And we define that by educating our users about NeedyMeds and the resources we offer, but also by educating our users about other resources that will help them in their healthcare journey, which is why we are so pleased to have our guest from Mended Hearts here with us today. So Mended Hearts is a national and community-based nonprofit organization that has been offering the gift of hope to heart disease patients, their families, and caregivers. Their mission is to inspire hope and improve the quality of life for heart patients and their families through peer-to-peer support. Yet, today's webinar is going to touch on a subject that is important to everyone, not only heart patients, which is how learning to advocate for yourself and how being an active part of your own healthcare team can improve your health. Now, to walk you through this important topic is my friend and colleague and somebody we're thrilled that is taking time out of her day to share her expertise with us, Andrea Baer. Andrea has a Master of Science in Nonprofit Management and Leadership. She's a board-certified patient advocate and is the Executive Director of Mended Hearts. Andrea has been deeply involved in advocacy efforts and working to ensure that the patient voice is at the table. She lives in Pittsburgh, Pennsylvania with her husband and 4 children, but she is here with us now. So without further ado, and as I say, hopefully seamlessly, I'm going to go ahead and mic and the screen to Andrea. Now, as she grabs that, I will remind everybody that if you do have questions during her presentation, you can go ahead and type them in to the questions section of your GoToWebinar control panel. With that, I will go ahead and pass the mic to Andrea and enjoy the presentation, everyone. Thank you.
Thank you so much. I am so excited to be here. I was going to show my video, but it seems like it's not showing correctly. So that's okay. Happy to be here with you all
We can,
today.
sorry to interrupt you, Andrea. We can definitely see you, but it looks like a bit of a side profile.
Yeah, definitely the wrong webcam. So
no problem. Thanks, everybody.
all right. We will just turn that off so you don't have to look at that side of me while I'm talking to you all. So I'm so excited to be here with you guys today to talk about becoming an empowered patient. It's a real passion of mine to make sure that patients understand their role in the healthcare team. Carla did give us some information about Mended Hearts. We have over 70,000 members now, with over 250 chapters across the country serving over 300 hospitals. So it's super exciting to be here with you. Before I get into the actual presentation though, I'd like to just give you a little bit about me. Not my professional career, because I think that while that's important, one of the things that makes it very unique and very much a passion of mine is the fact that my son was born in 2009 with a congenital heart defect and Down syndrome. He had open heart surgery at 11 weeks old, and he has had 6 surgeries and multiple hospital stays in his short life. This is my family on the screen. As you see, he was my 3rd child, so I thought that I was pretty good at this mom thing and had no idea what I was about to face. Navigating his care was very daunting and scary, especially in the beginning. And this healthcare decision making was really a foreign concept to me. I had no idea what I was doing, really. And I was alone. And even though I was surrounded by family and friends, I just felt so alone. So I'm sure that if any of you have been diagnosed with any type of medical condition, the very beginning, you always feel confused and overwhelmed. I know I felt like I was at the mercy of the doctors because I didn't really understand the medical care conversations that were happening. So I felt like I had to blindly trust the doctors. Felt out of place asking questions because really I was raised to think that doctors know best. And so I was just there to listen to the doctor and do what they said. But what I've learned is that you get in life what you have the courage to ask for. And that is a quote by Oprah Winfrey, but I think that it's very important for us to understand that as patients. So we look at what is empowerment. I think that empowerment is not only asserting your rights, but you have to understand that responsibility and ownership comes along with that empowerment. So you can understand the why so that your guidelines can be applied. You can weigh the impact of the decisions on all stakeholders. And I say all stakeholders because it's caregivers, it's family, it's, you know, the doctors and the nurses and the patient, it's everybody. That decision is going to impact everyone. And so everybody needs to have a seat at that table. And it really makes more trade-offs and not less. But really importantly, it's an earned privilege and not a given right to be an empowered part of your healthcare team. So, becoming the CEO of your healthcare. I love this because as patients, we have to learn to be the CEO of our healthcare. You know, empowered patients are 100% partners in their healthcare decisions. They're educated, they take what they learn and they understand, and they make those decisions based upon that fact, not just on what they want in that moment, but what is good for them long term. So the first step in being an empowered patient is to educate yourself. And this is interesting to me because research shows that you need to hear a message 7 times before you completely retain that information. So when you're in the middle of an initial diagnosis, a lot of times you're in a crisis situation. I know for me, I had just given birth 6 hours prior to getting all of this information. It makes it even harder to retain that information. And then medical language is hard to understand, especially for a patient who might be in crisis and might be emotional at that time. And so you need to make sure that you truly understand what they're telling you. And if you don't understand, you need to ask them. Ask your doctor to use, lay language, a simpler explanation, but continue to ask the doctor to explain to you what is happening and what's going on until you do understand. And that's your right as a patient to understand all of it. So the first step in that understanding is understanding your diagnosis. And so do you really understand it? What's the diagnosis mean for you? You need to know short-term and long-term prognosis for that diagnosis. And is it lifelong care versus short-term treatment? And I use an example of, let's say you have to have your appendix removed. So that's a short-term treatment, right? You know that once the appendix is removed and you're treated with whatever treatment they've decided, maybe it's an antibiotic, or then that's done, right? You're done. Versus having something like heart disease, where it's a lifelong care. You need to learn to manage that through your entire life, versus a one and done type of treatment. And so that's something that you need to ask about as well. And every diagnosis is different for every person. And so getting to the heart of what the diagnosis means for you is really important. So keep asking questions until you understand it. Keep asking the doctor to re-explain it if you don't get it the first time. And sometimes that means you have to go back to them, maybe at the next appointment, and say, the last time we were here, you told me this, and now I'm trying to understand it a little better. Could you help? So really being a part of the team. I love this dogs because they say together each achieves more. That's your teamwork. And being a part of the team means that you understand and you're making that shared decision. And so you need to understand all of your options. Are there other treatment options that you can consider, or should you consider? And are you in the right place? Are you with the right physician or the right healthcare professional that can help you the best? All of those things need to be explained to you to be a full part of that team. And then you need to voice your opinions. I love this guy. He says he hates cats. He wants a dog scan. So that's really funny. One of the things I like to say is you need to speak up, make sure they understand what you're comfortable with. And if you're not comfortable with something, you need to explain that to them. A lot of times it's something where they can help you be more comfortable with a procedure that you have to go through or a treatment. But you need to be considerate in your requests and give respect to the medical team so that they can better help you. But if you're afraid, say so. Let them know I'm really afraid and this is what my fears are, because they can help you be more comfortable with that treatment as long as you're voicing your opinion. So some of the things that you need to think about, and this is one of the things that we talk about before surgeries. This may not be applicable to you, but maybe it's a procedure or a treatment. Some of these things are really important questions that you should ask. One is, how often have you performed this procedure? What is your survival rate? What is the average recovery time at your hospital? What complications are likely to occur? How does the care team work together? And how well do they handle patients with this condition? What is the mortality rate at the hospital for this procedure? But here's a big note. Mortality rate may be a good indicator because some may not be a good indicator because some hospitals take higher risk patients and therefore have higher mortality rates. And so that in and of itself is definitely not one thing that you should look at. You should look at all of those other things in advance of that, and then just know that the mortality rate does play a part. And then also what resources are available for me at this hospital. Some hospitals and hospital systems have better resources for patients above and beyond that medical care that you're getting. If you have a choice to go to where you can get a full spectrum of care, and they're helping you emotionally and with your socioeconomic things that you need, then that might be a better place for you. So look at all of those things before you decide on a treatment center. And so once you've gotten all of that information, think about and talk to your family or your caregivers, your loved ones, what will work for you. So you need to be able to do a couple of things. One, need to be able to afford the treatment. The best treatment in the world may not be available because you can't afford it. And if you can't afford it, you need to let the doctor know before you leave the office or before you leave the hospital. Say, look, I am not going to be able to cover this copay next month, so I'm going to need help, or I'm not going to be able to take this medication. Because it's better than leaving the hospital knowing that you're never going to take the medicine and not explaining that to your doctor. There may be a less expensive medication that they can put you on. Are you going to be able to take the medication that's being prescribed to you the way they're asking you to take it? Sometimes I can remember a time when my son just refused medications, refused it. We used to have to hold him down, and it would take 4 people, and we would have to shove it down his throat, and it was traumatic and horrible. And so whenever he would need an antibiotic, I would ask the doctor, look, can we give him an injection of antibiotic? Will that work for this antibiotic that he needs? Because one shot is a whole lot less traumatic than 3 times a day for the next 10 days. And a lot of times that was an option. And so we worked around that. Otherwise, who knew if he was going to get all of his medicine, because he would spit it out, and sometimes we wouldn't be able to hold him down. Excuse me. And then what lifestyle changes will you need to make? And are you able and willing to make those lifestyle changes? And again, you need to be honest with your healthcare team. If you're not willing to make that lifestyle change that they're telling you that you should make, be honest with them and say, look, I don't think that's something I can do at this time. Are there any resources to help me with that? Or are there any other options that we can look at? Because sometimes you do have other options and they're just not thinking about them. So always bring that to your healthcare team's attention whenever you just don't think that treatment's going to work for you. When you leave your hospital or you leave your doctor's office, you should feel confident that this treatment plan that you've created as a team is going to really work for you. And then once you get home, proceed with caution about online research. Only go to reputable websites. So that means no Wikipedia. That means no Facebook, no TikTok research going on here. We need reputable websites. The NIH, the CDC, peer-reviewed journals, patient advocacy organizations, like Mended Hearts, and I'm sure the American Cancer Society, the American Heart Association. Connect with them for disease-specific information. And so you can research and prepare all of your questions for your physicians when you see them again. Be careful comparing stories from other individuals. That's one of the big downfalls of the internet. It's amazing to connect with people, amazing to understand and, you know that you're not alone, but there's a big danger in hearing all of these horror stories of medication fails or surgery fails, and then you get really scared, or you think that something's wrong with you because this wasn't your experience. And be careful comparing hospitals and doctors because based on the word of other people, because the greatest hospital in the world is the one who saved my son. And I'm sure that if something had a bad outcome, that would be the worst hospital in the world based upon that one simple fact. And sometimes it's very unlikely that the hospital is really that bad. It's just my experience. So try not to do that as well. And once you've gathered all of those things and all of that information on your treatments, on the hospital and the care team that you're going to, and if you're able to, move forward, then you can make a shared decision with your doctor. It used to be a time and that there was a paternalistic way of medicine, right? Where the doctor was the no all be all. They told you what to do and you just did it. And then we've kind of moved away from that, thankfully. And now this shared decision making is so important. And that is going back and forth with your doctor. You'll see on the screen the circle of shared decision making because it's not a one and done thing. It's a back and forth communication on what works for you, what the doctors think you need, and going back and forth until you come to this agreement on what's the best treatment plan. And shared decision making can only happen if you're educated and you understand that decision you're making. And that means you have all of the information about all of your options. You've been given time to digest and think about your decision. You and your family are on the same page and that you feel confident in your decision. Some hospitals may not have different treatment options available, so they don't share those with you. You need to ask, are there other treatments that are not available here that I can research to understand? Because if you don't know all of the options for treatment, you can't really make that shared decision. You've got to have all of that information. And again, as I was talking before about the clinician and the patient, the paternalistic way of doing things was that the doctor would give you the information, they would give you the recommendation, and you would just do it. Then they kind of moved to informed medical decision making, where, okay, people want to know more information before they make their decision. So I'm going to give them more information, and then I'm still going to give them the recommendation, and we're going to move to that. And now we're moving into this shared decision-making society where we get that information and recommendation, we put our values and preferences into that discussion, and we have that back and forth with the clinician until we come up with a great plan moving forward. So you should know your rights as a patient. They're all here on the screen, but the most important thing is you have the right to be treated like a part of the team. You have the right to ask questions and get a second or third or fourth opinion and suggest alternatives, feel confident in your team, and you have the right to change your mind, which is something that some people just really have a hard time with. They're like, well, I said I would do it, so now I'm stuck. You're not stuck. You have the right to change your mind. If you've decided that, I tried this, it's not working for me, I need to, change this treatment plan. You have every right to do that. And then you do have a right to appeal decisions if you don't agree with that. And that mainly is discussing things like with the insurance company, you have the right to appeal their decisions. A doctor who says no, they're not going to do something, you have the right to appeal that if you don't agree. I want to take a minute and talk about the importance of caregivers, especially in a journey that is lifelong. It's so important to have that supportive caregiver. And it may not be a family member, it may be a friend or a coworker or somebody at the hospital even who has taken you under their wing to be friends with. It's really important to have that caregiver though, because they can help you on this journey. If you have a family member, have them attend and include them in the conversation when it's applicable. I always laugh because if I sent my husband to the doctor with my child, I would never know what the doctor actually said because he would be like, well, they said he was fine. Um, and a lot of people are like that. They just hear, yeah, he's fine, and then move on. So sometimes it's nice to have that caregiver with you so they can hear the different insights. Um, Maybe they see something that you aren't seeing as the patient, and they can say, hey, I think that you may be experiencing this and just weren't aware of it. I see your decline in your ability to walk up the stairs or something of that nature. And so make sure your caregiver feels empowered to ask questions about your care as well. Um, and having two sets of ears can always help. One thing, though, as a word of advice for caregivers, if there's anyone listening, you need to make sure that you're playing that supportive role and not taking over the role of the patient. And so it's always important to make sure that you're empowering the patient and supporting them on their journey because it's really about them. And that's your role as a caregiver. And so then finally, we want to make sure that you're taking responsibility as this informed and empowered patient. Um, Make sure you're communicating and every step of the way with your healthcare team, you're voicing your concerns, you're feeling confident, and realize that you can change your mind. Like I said earlier, if it's not working for you, take responsibility for those decisions, and take responsibility for the things that you're doing with your healthcare because it's so vital for us to be an active part of our healthcare team. And finally, before we wrap up, I just want to let everybody know that this is so important to realize that you are not alone. If you can connect with others who can help you on your journey and share your fears and struggles with you, get support for your lifestyle changes and emotional support. Those things are so important to the journey that you're on, whatever journey that is. There are so many different patient organizations who support others. Um, and so my best advice is to get support from others who have been where you are and they know how you feel. And you can, find that place where you belong with them. And then typically, patient organizations have a lot of educational opportunities. So you'll definitely be able to get yourself some more education and feel even more empowered as you go. I know Mended Hearts, we have education all of the time. Every month we're doing something different. And I'm very certain that all of the other patient advocacy organizations are also doing the same. So thank you so much for the time. And I am happy to take some questions.
Andrea, thank you so much for that invaluable presentation and taking time out of your day to share your expertise with the Needy Meds audience. And I can see it's clearly resonating with those that joined us today because we are getting a lot of feedback and questions for you, which we will get to momentarily. In the meantime, I will remind everybody if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. And I also want to remind everybody that Needy Meds here is here as a source of support as well. If one of the obstacles you're facing on your healthcare journey is affording your medications and other healthcare costs, please reach out to us. You can call our counselors at that toll-free helpline. They are available weekdays 9 a.m. to 5 p.m. Eastern time, and we also have Spanish speaking counselors. Of course, I'll put that 800 number up at the end of the presentation as well. Or you can certainly check out our website. Visit that healthcare savings tab that I pointed out in the beginning of the presentation. And what you're looking at on the screen is some of those healthcare savings categories you will find under that healthcare savings tab. And as we get to those questions coming in, as promised, I want to leave up the contact information for the Mended Hearts, as well as the contact information for Needy Meds at the bottom of the screen. So a couple of things that I wanted to mention, they're more comments from the audience as opposed to questions, is we received a number of comments saying, resonating with what Andrea spoke about regarding being careful about where you're getting your information on the internet. Being wary of Dr. Google is certainly something to keep in mind. Again, Andrea mentioned also that education resources, being educated yourself goes a long way in helping yourself to become an empowered patient. Needy Meds also has a ton of educational resources in addition to these webinars, but I do hope you check out future webinars. And again, you can find those on the calendar of events on the bottom right hand of our home page. Another resource that I think makes sense to point out during today's presentation is under that healthcare savings tab in the top middle, you will find a link to diagnosis information pages. And actually, we have a couple, soon to be more, diagnosis information pages that we've partnered with Mended Hearts to create. And they're exactly what they sound like. They're pages dedicated to reliable and reputable and current information about a particular diagnosis. So again, I just want to take a moment to suggest to everyone to check out those diagnosis information pages under that healthcare savings tab. So with that, let's get to some of these questions coming in. Now, this is something you touched upon, Andrea, but I think it's a great opportunity to drive home what your opinion is, which is it okay to get a second opinion? And sort of along with that is, how do I even know I should get one?
Yeah, so it's really important to understand that you can absolutely get a second opinion. And the way that I personally think about this is if you feel uncomfortable with the direction that the care that you're being given is, if you feel like it's just not adding up, or if it's something really serious. So if it's, out of the blue and they're saying you're going to have open heart surgery and these things are going to have to happen, and you're like, well, this doesn't even make sense because I've felt really great up until this point, maybe you should get a second opinion. But I always say trust your gut because you know your body the best. And if you feel uncomfortable with the treatment that you're being given or the healthcare team that you've been assigned, it is absolutely critical that you get a second opinion. And the doctors who are really good at what they do would not be offended that you're getting a second opinion.
That is a really good point and a really good question. The next question that came in, Andrea, and it's really funny because just a handful of years ago, I would have probably asked this question myself, which is, how can I be an advocate for my dad without making him feel like I'm taking over?
Yeah, and that's so hard, right? Your dad or your husband, and I'm not trying to pick on men, because it could be your mom too. But when you're in a situation where you are playing the supportive role, you need to make sure that you're actually including the patient, and talking to them outside of the doctor's office. So maybe the conversation between your dad in you needs to happen prior to being at the doctor's office or not in front of the doctor. And the reason I say that is because when we're put in a situation where we feel pressured or attacked, we typically, as human beings, put up a wall, right? And we've got this defense mechanism, and we're like, leave me alone. I know what I'm doing. Um, Whereas if you have that conversation in privacy and in the comfort of a place where you both are feeling on equal ground, then sometimes it goes over a little better. So my suggestion would be, hey, Dad, we're getting ready to go to this appointment tomorrow. And here are some things I think we should talk to the doctor about. What do you think? And see what they say. So you're not taking over the care. You're just being a part of that team.
Very helpful advice, and probably a very common question that people need help answering. Another question coming in is, and we get a lot of these questions at Needy Meds regarding people living in remote or rural areas. So I have someone who's reaching out saying that they are in a rural area where the hospitals and doctors that they're in contact with have limited exposure to rare diseases. And sometimes, because it's maybe something that the doctor isn't familiar with, the patient may have trouble being taken seriously. So the question, and this actually dovetails nicely into another question I see coming in, but this question is there a way, and if so, what is the best way to possibly educate your doctor or your healthcare provider without damaging the relationship, wounding their ego, etc.?
Such a great question. And I think it happens all of the time for a lot of people. So here is what I suggest. And I actually am using this myself in an upcoming doctor appointment. I am going to take what I've learned in my research, written down or printed out if you have the capabilities of printing it out. That's even better, but maybe it's a website. And you say to your physician, you know, I've been researching and here is a treatment option that I think might be really good, or this is something that I think that you might be interested in reading. And I thought maybe you could look at it and then give me your feedback and we could talk about this treatment option, or we could talk about the way that somebody in Boston is handling this type of rare disease. Thought you might find it interesting, and then maybe it's something we could look at for me. Let me know if you think it would be right. Um, Again, being a part of that team on equal footing and equal ground, you're not trying to shame anybody or call them out, but you want to really educate them because they truly might not know. I think that doctors would be very interested to learn about new things that are happening. And they may come back to you and say, you know, sounds like it's really great, but we don't have that kind of capability. But they might also come back and say, hey, you know, I think maybe we could try this, or, you know, maybe I can connect with this physician here at this hospital and we could, you know, learn about this. So I think it's always worth taking that education from a reputable source. Don't take a TikTok video and say, hey, look what I found. um, but definitely taking that education to your doctor.
Great suggestion on how to approach it. And the actually, this, like I had said when I asked you the earlier question, this dovetails really nicely into a question, actually, a number of questions we're getting about this topic, which is how do I find out about resources in my area?
Yeah, so I think a couple of ways. One is starting at patient organizations for your disease specific journey, you know, Mended Hearts or the Cancer Society, or, you know, whatever disease specific, Needy Meds. finding out about treatments can usually send you into um, different areas where you can research. Hey, is TAVR, for example, transcatheter aortic valve replacement, available in an area near me? Um, and then you can talk to your local hospital about resources. Sometimes your hospital knows what different resources are available locally at other hospitals. They just know it's not available at theirs. So sometimes they'll be able to give you that information as well. I always like to look at my research as a circular approach. I'm not just going to one place and getting that information. I go to a couple different places from a couple perspectives, and sometimes that starts at a pharmaceutical or device company's website, right? And then you find out about that treatment, and then you say, okay, so let's see what the CDC or the NIH or the FDA says about it, and let's see what the patient organizations say about it. And once you've gotten all of those perspectives, then you'll know, hey, this is a pretty good start of a treatment.
Thank you so much, Andrea, and thank you to our audience for these great questions. I do have other comments coming in, and one thing that I want to mention that I feel I would be completely neglectful in stressing this, and I'm reminded because we have a pharmacist that is very involved with Needy Meds and a friend of mine who joined our webinar today, and he reached out to share the comment that as pharmacists and other healthcare professionals he works with in the area, they do help patients participate in remote care support groups, which I think is really important. But the other point that I wanted to stress is refer to your local pharmacist as a source of support as well. If you have questions in particular about the medications you're taking, if there's cost savings options, consider them part of your healthcare team as well. I thought that was worth mentioning. So
Absolutely. I think that's great. I also think that if
I
there are cardiac rehab center individuals or um, occupational therapists or physical therapists, anybody that you're in contact with as a part of that healthcare team may have information that you can get from them.
absolutely. So we do our best to keep the question segment relatively brief. So if you did have a question that we didn't get a chance to answer, as I said, don't worry, we will follow up with you via email. But of course, if you can't wait or you have other questions, don't hesitate to reach out to the Mended Hearts at the contact information on your screen. Visit their website, or call their information line or resource center. You can always drop them an email too. Of course, you can find the contact information for myself and Needy Meds at the bottom of that screen. With that, I want to thank our audience members for taking time out of their day to join us for today's presentation. And a huge thank you to my friend and colleague at the Mended Hearts for sharing her expertise with the Needy Meds audience. I do hope to see everyone's name pop up in future webinars. With that, thanks everyone and have a great rest of the day. Take good
Thank
care.
you.
Bye.
Bye.